family, and welcome back to Beyond the Chart by Now Included. I'm Dr. Raquel, medical editor at Acclinate, and I am so glad you're here. Today, we're talking about the power of trust, the importance of owning the conversation, and how we navigate the intersection of physical, mental, and social well-being. Joining me today is Dr. Charis Chambers, known to millions of you as the Period Doctor. Dr. Charis is a board-certified gynecologist and the author of the upcoming revolutionary guide, The Period and Puberty Parenting Revolution. I am stoked. I cannot wait to get into this. She is a powerhouse advocate for reproductive justice and a trusted voice for families everywhere. Dr. Charis, before we dive into the charts, I want to start with the human. Could you share a bit about the person behind the coat and what called you to do this work?
Yes, Raquel, thank you so much for having me. Gosh, when I think about how I got to this work, it wasn't the most direct path, which can be surprising to people because I did grow up with an OBGYN as a father. So my father was an OBGYN in our small town, and I grew up seeing people acknowledge him, at church, at our school, at the local grocery store, like, hey, this is the person that delivered you, like gesturing to a kid who's like, you know. And so I knew the impact of the work, but I didn't feel called to the work until really I got to Spelman College. So when I got to Spelman College, one of the bigger things that we emphasized was servant leadership and what that looked like. And I learned things about myself. I wanted to be a voice for those who were vulnerable, that I wanted to be a part of someone's process where I actually had the authority and the expertise to change the outcome. And so that led me to medical school. And once I was in medical school, I fell in love with obstetrics and gynecology. But during that time, I observed someone talking with a mother-child pair about reproductive health. And I loved the opportunity for education and advocacy and all of those things. And that really awakened like the calling inside of me to lean into my subspecialty, which is pediatric and adolescent gynecology, and to always kind of speak up and make sure that my voice was one of those voices of advocacy for my patients. And so it was quite a circuitous route, but along the way, as I found little pieces of myself and clarified who I was, that is what led me to this work.
I love that so much because you can tell in your content, even your social media content online, or how you show up when you're interacting with people and really advocating for adolescents and learning more about themselves. Like, we can feel your passion through the work. So truly, it's just such an honor to talk to you. And I truly feel lucky that I get to be in this generation where there is a doctor like you who is helping people to own their bodies. Like, we talk about it in a very textbook way, but none of us are by the book. All of us have our own experiences. And so it's beautiful to watch how you break it down and how you help us to see, this is your body. I want you to have the knowledge so that you can be empowered when you go to the doctor. So thank you so much for being here. This is exactly why your voice was so important in this space. Shout out to Shayla. She's like, if we're doing this, we have to hit up Dr. Charis. We cannot do this without her. So shout out to Shayla. But you're touching on the fact that education really is the cornerstone of safety and self-worth. It really starts long before someone ever steps into an exam room. So yes. I love that you called that out. Before we get into our first case, I do want to pause a moment and really define a term that we'll talk about in this series about those unseen factors of health. I know for you, Dr. Charis, this is something you hear all the time, but for our audience, I always like to make sure we talk about our social determinants of health. Sometimes you may see it abbreviated as SDOH. The World Health Organization defines your social determinants of health as the non-medical factors that influence your health outcomes. Put simply, they're the conditions in which you are born, grow, work, live, and age. Experts typically put these into about 5 groups. So your economic stability, so your income, your employment, and your housing. It also includes education access and quality. So this is your literacy and the resources available to you from a young age. Also, healthcare access and quality, which is something we'll talk about today. This is having a provider you can trust and the insurance to see them. Also, your neighborhood and built environment. This is access to healthy foods, clean air, and safe spaces. That fifth part of your social determinants of health is social and community context. This is your support systems and, very importantly, your experiences with discrimination, or as we'll see today, generational silence. This is what we like to call 360-degree care or whole person care. Understanding these social determinants of health is the secret sauce because it helps us identify the root of the root of the root. Research shows that clinical care accounts for about 20% of health outcomes, while the other 80% is driven by these social factors and behaviors. When our communities understand this, we stop asking, why is this person sick? And we start asking, what in this person's environment is making it hard for them to stay well? So with that 360-degree view in mind, let's take a look at our first case, which sits right at the heart of your book, Dr. Chambers, Period and the Puberty Parenting Revolution. Dr. Charis, I want to introduce you to Maya, who is 11, and her mother, Alicia. They live in a community where reproductive health is still whispered about, which was also very true for me. And Alicia's own puberty experience was riddled with silence and embarrassment. Maya's periods are so painful that she's missing school and pulling away from her sports team. Alicia wants to help, but doesn't have a template for how to talk about it without making it awkward. So Dr. Chambers, her chief complaint, as we heard, was severe dysmenorrhea or painful periods, school absenteeism, and growing anxiety around her body. Alicia, the mother's generational silence isn't a personal choice. Isn't just a personal choice. It's also a survival tactic born from a healthcare system that historically ignores Black women's pain. Alicia is trying to give her daughter what she never had, but she's battling the generational silence she grew up with. Alicia worries that a pelvic exam or a trip to her OBGYN is too much too soon, while Maya is beginning to view her body with fear rather than confidence. So I know this is your wheelhouse, and in your book, you talk about period and the puberty parenting revolution. So for a mom like Alicia, how does she start owning the conversation today so Maya doesn't have to grow up with the same embarrassment Alicia felt?
I mean, this is like almost my bread and butter. These are the patients I love seeing, and I love seeing them because I connect with them and I understand so deeply what they're carrying with them when they come into these visits. And so for Alicia, and this is how I would love to do it. I'd love to just get the parent first, right? And say, Alicia, like, right? I'd love to say, one, you are exactly who your daughter needs, right? You have raised her, you know her in and out, and you have her best interests at heart in a way that no one else can have. That's just something that is unique to a mother. Being a mother myself, I know that I want what is best for my child in a way that no one outside of me can understand or replicate. That is the first thing to acknowledge within Alicia. The second thing to acknowledge is, I'm so sorry that your period and puberty experience was riddled with so much shame and stigma. That is not unique to you and it is not a unique flaw. And while it is not your fault that that is the case, it is still your responsibility to make sure that your daughter doesn't have the same experience. And so I like to let parents know that I can partner with you on this opportunity, on this, on this whole journey to making sure that, her daughter is better supported at this time. What I like to kind of open up with is when they come to see me or come to see a doctor, they don't have to have a pelvic exam at that first visit. As a matter of fact, it's not even indicated until age 21 when the pap smear is necessary. So that is not the standard anymore. That used to be the standard. When you walked into an OBGYN practice, the expectation and understanding was that you were going to have an exam. And so with my new patient visits, I always sit them down and I say two things. I say, you know what? A lot of people come to the gynecologist and they are super nervous. So I want you to know that I am a special gynecologist who is the first gynecologist that many people see. And so this visit is not unexpected. You are not weird. You are not out of place. In fact, you are in the right place. The second thing I say is that I am not going to do anything that you don't want to do today. You have consent over your body in this room and outside of this room. And so I'm not going to do an exam or a procedure without your express consent. And oftentimes when I say those two things, those validating things, the moms start to cry because they know that that was the fear they carried. They know that their first visit was not the same. And so acknowledging that historically this was the case and that I, as a person who is dedicated to this work, want to make this better, that helps to remove that concern of trauma and things being too much too soon. It is not too much too soon if your daughter has severe pain that makes her miss school. It's already happening. The consequences are already at play. It is time to talk about solutions. But it's important to talk about solutions with someone who gets this and is dedicated to addressing this without traumatizing her. And so that's the missing piece of this story. You have to be able to partner with someone who can be trusted, who knows that in order to help your daughter, they do not need to traumatize her, and who also believes her and believes that she is worthy of a pain-free life. Those are the things that are necessary for this conversation.
That is so powerful. And I can only imagine how healing that is for the mother and the child. Like, I can only imagine to hear that for the first time, even as an adult, to hear, like, you have consent. Like, if there's something you don't want to do, like, I've never heard that before.
No, most of us haven't, and that's what they say. I've never heard that before.
Wow.
Heartbreaking that honoring patient autonomy over their body in the gynecologic space is like revolutionary. Like that should be standard. And so there's a lot that medicine needs to improve. There's a lot of onus on the medical system that has contributed to the fear and the distrust that people carry, especially people of color. I feel as a physician, as someone who wears a white coat, who works in this system, it is my duty to acknowledge that, to speak truth to that, and make sure that you understand that I know what you carry is not your fault. It is not a burden that you selected and picked up. It is something that was passed down from generations because this system mistreated people that look like you, and it is woven into your genetics to try to protect yourself and the people you love by avoiding things that have historically harmed you. That makes sense. That makes sense.
I mean, we could just stop here, but I'm literally in shock. Like, I'm in shock that this has not been said before in the way that you are saying it. And I truly pray that it reaches the right people, the people that really need to hear it, because how many of us go into the doctor like with our guards up, like just ready to say, like, like, oh no, I know this is going to be bad. But just by you apologizing for what had nothing to do with you,
No,
but you're setting the tone to first of all, like, you're safe here.
you're safe
Like,
here. That's the summary statement, Raquel. You are safe here. And I know what you are afraid of. And so I'm looking out for those same things, and I'm committed to making sure that they don't come and harm you. And so that makes it so that people feel that they can give you what they're carrying, that they can share it, and then you can have a collaborative conversation on how to make things better. But until you make people feel safe, you can't not expect them to be vulnerable with you. You can't expect them to open up with you, and you cannot expect them to partner with you for better outcomes.
I really like, to me, this really switches the dial on what people think about their OBGYN, and especially adults who think, oh, your OBGYN is only for pregnancy. And so I love that you're kind of switching what we believe about care. And so why for you, especially as it relates to your book and your practice and how you see patients, why is it critical for a child like Maya to see a gynecologist early, even if they aren't sexually active yet?
Oh my gosh. One of the things that I fight every day is the myth that you can only see a gynecologist if you are sexually active. That's almost like you can only utilize healthcare if you're bleeding or if you're in pain, right? That is a risk response. That is a reactive response. That is not protective, and it doesn't protect your health. And so if we start to think about reproductive health as something that applies to anyone who has reproductive female organs, then that means that they are eligible to see somebody like me. But more importantly, in Maya's case, her process of having a period is already impairing her daily activities, right? There's already something that is wrong. And so because her pain is that severe and it is preventing her from going to school and showing up scholastically, which we know at school absenteeism affects so many things in people's futures and how they show up in life, that needs to be addressed. What I would be concerned about is something like an endometriosis, for example, which can be present in our young adolescents. The youngest patient I've personally diagnosed was 12. The youngest patient diagnosed in the literature is 8. We think of it as something that is diagnosed in the 20s and 30s because that's when we start to look for it, because women are trying to have babies, and we've decided that when you're trying to have a baby, your body matters. But I tell my patients, your body matters today. You matter today. I care that you're missing school. I care that you're unhappy. I care that your pain has made you have anxiety around your body, and I want to improve that today. What we know is that earlier recognition, earlier diagnosis, and early treatment improves the outcome. Endometriosis is a chronic and progressive condition. That means it doesn't go away and it doesn't get better, but we can prevent the progression if we recognize it early. We will never recognize it early if we lie to our daughters or we perpetuate the misconception that they cannot get gynecological care unless they're sexually active or trying to have a baby. It's inappropriate and it causes harm.
This is life changing for me to hear, and I know it's going to be life changing for the families to hear, because people suffer forever.
Forever.
I mean, they suffer forever, and they're like, oh, well, I thought this was how I was supposed to feel. I thought this was just a normal part of being a woman, or, having a period. Like, I literally thought that this was normal. And so I really want for a moment to pause and have you explain, like, hormonally what's happening during period pain, and at what point does normal cramping become a medical concern that requires intervention.
So also in my new patient visits, I love to take a moment to just explain physiology. I'm typically holding like a uterine fallopian tube ovary like model in my hand. I'm like, this is your internal organs. But what I typically share is that when we're having our menstrual cycle, there's fluctuations of hormones that dictate and kind of signal what your body's supposed to be doing. The hormones that we typically think about are estrogen and progesterone, and so I'd like to simplify it by focusing on those. So estrogen rises, and that thickens the uterine lining. It makes it nice and fluffy, is what I tell my patients, so that your egg has a great place to land. And so once that uterine lining has thickened with the presence of estrogen, the midpoint of the cycle is ovulation, which is the release of an egg from the ovaries. I always tell my patients you're born with all of the eggs you'll ever have, and so it's not a matter of making new eggs, it's kind of releasing them from storage, and your ovary does that by forming a small cyst, and then that cyst ruptures, and that is ovulation. Once that egg is released in the form of ovulation, progesterone becomes the dominant hormone, and it rises, and it kind of hangs out to see what's going to happen. That egg can turn into a pregnancy, or if pregnancy doesn't happen, that means we need to have a period to start everything over. Okay, so once progesterone has kind of peaked, if there isn't a pregnancy, it drops kind of rapidly, and it is the withdrawal of progesterone that triggers the bleeding, right? And so that withdrawal of progesterone also triggers that endometrial lining to release prostaglandins, which are inflammatory markers. Those inflammatory markers cause contractions. It causes the uterus to actually cramp. It causes there to be ischemia or reduction of blood flow to the uterine lining so that that shedding of the lining takes place. All of those things, secondary to the prostaglandins, causes discomfort and pain. We call that kind of the physiologic discomfort, or like primary dysmenorrhea, which is pain that's related to the normal processes of having a period and not necessarily an underlying condition. Now, so that type of pain, when we say it's normal, it can be managed with over-the-counter pain medicines. That's our anti-inflammatories, our Tylenol, things of that nature, even heat therapy or just rest. And it does not impede your daily activities. You can still do the things you need to do. You can still go to school, soccer practice, dance. You can still do debate. You can still go to work, all of that stuff. When your daily activities start to be altered, or when you don't have improvement of the pain with over-the-counter pain medicine, or you have associated nausea and vomiting, those sorts of things, those are teetering into abnormal. That's when it becomes a medical concern where I want to look to see if there's something underlying, some sort of pathology at play that is contributing to that pain. So that means evaluating for like fibroids, polyps, adenomyosis, endometriosis, even PCOS, all of those things that can make period pain worse to a degree that it impairs your daily life. So that distinction needs to be known. Parents need to know that distinction, because you need to know when to act and when to wait, when to seek care and when to manage it on your own. And many people do not have a clear understanding of that because they're not having the conversation, because it's cloaked in silence. And so their only comparison is themselves or their mom or their sister, and they might all have fibroids. And so they're comparing abnormal to abnormal to abnormal, which looks normal in comparison. Or they might all have endometriosis. So they're comparing debilitating pain to debilitating pain to debilitating pain. And they're like, hey, this checks out. No, it doesn't. Y'all all abnormal. We have the conversation outside of our family, outside of our circles, we may never recognize it. And the difficulty is conflating normal with abnormal and abnormal with normal. And that is something I'm working to dispel and to improve.
That in itself, to me, already answers something that I was thinking for myself. So I wanted to get your book for my nieces, but I honestly think that this is something I also want to give to my friends. Yes, it's for parents to help understand their kids and for, like kids to also, or adolescents to learn about their bodies. But how many of us haven't had a chance to realize what is abnormal? And you are doing that in a way that I believe hasn't been done before. I've never seen a text that really breaks this down in this way. And in your book, your guide is for parents to rewrite the rules, but all of us need
All
to
of us,
rewrite the rules.
it needs to be a cultural rewrite. Like literally,
Yes,
I couldn't agree more.
yes, all of us. But you are asking, Alicia in this case, but parents to rewrite the rules in your new book. And if a doctor tells a parent like Alicia that Maya's pain is just part of being a woman, like you said, how can that parent like advocate for tools to, make sure her daughter has a better outcome?
So I think if a doctor were to tell Alicia that this is just a part of being a woman, that is dismissive at on the surface level, but at the core, just profoundly incorrect. Like that is a flawed like frame of thinking around reproductive health and patient outcomes that would for me and someone I loved, I would say, I think I need you to get another doctor. I personally don't believe that patients should be burdened with educating doctors on what they should know. The perfect patient-doctor relationship in my mind is a meeting of experts, right? There's an expert in medicine and in the field of need, and then there's an expert of the patient, them being an expert in their body and their lived experience. And a meeting of those experts is the appropriate collaboration. But if you as a patient have to educate that doctor on their job, you need to get another doctor. And so a doctor that believes that pain is just a part of how you need to navigate life is inappropriate. Now, that is a point of privilege, right? It is a privilege to be able to choose another doctor, and people aren't always in that scenario. So if you cannot just try to get another doctor, or that would be prohibitive, then speaking up and saying, actually, I need you to understand that this is preventing her from going to school. This is preventing me from going to work, and stating the thing that is preventing you from doing. Because even if someone doesn't have the best basis on understanding what's normal and abnormal pain, once it tips over into impairing daily life, that is generally the standard by which we say this is a disorder. This has to be improved. There's a standard that needs to be improved that is clinically relevant that I can document and say this is why I need to step up my intervention or my evaluation. So that should get their attention. If that doesn't get their attention, the second thing I would say is I need you to have a plan for her pain before we leave here. Before we leave here, we need a plan for her pain to one, try to improve it. And what is the next step if it doesn't improve? That is demanding, deliverables. It's demanding like, this is my standard. And so I think those are ways that people can advocate for themselves. If possible, I would say get a new doctor. If that isn't possible, then I would say reiterate your issue and actually give it greater context that shows what is being impaired. And then third, I would say demand something that is the outcome for that visit. I need a pain plan. I need a bleeding plan. I need a next step. I need to understand the workup. I need evaluation. I need to know where we are headed and what your clinical management and your clinical thinking is telling you right now so that I feel better about the next steps.
Absolutely. And I think oftentimes when we go into the doctor, we don't have this type of plan. We're just going in knowing what's wrong, but not being equipped to say, this is what's happening and we cannot leave without XYZ. And I love how you also advocated for the parent to talk about this is how it is impacting my child's life.
Yes.
Even us, that's why I think it should be a rewrite, like across the board. Like I truly believe that you are taking this and helping all of us be more accountable for our health. Like I truly feel that. And it's like when you go in and you say, this is happening and it is impacting me in this way.
Yes.
Now what is our plan? Because sometimes it's like, oh, you have this, okay, well, let's do this. No, let's be intricate, very intentional
Right.
about those next steps. So that is so powerful for Alicia and for all of us. And just to wrap up this first case, I really want to ask you, as an OBGYN, how does a positive first experience with the gynecologist prevent worsened health outcomes later in her life?
When someone has a negative initial experience with the gynecologist, they are more likely to avoid follow-up care, they're more likely to avoid other encounters with healthcare, and they are more likely to seek outside interventions for their issues. So that means things that are not medically based, things that have not been studied. We always get mad when people are looking things up on social media and on Google, but if they cannot trust the medical system, where are they to go? It is a byproduct, it is the result of a medical system that fails patients that they start to look in other places. And then if patients are not willing to go to the doctor, if they are worried about being traumatized or being mistreated, then that's going to delay their care. And so that means that if they really need something that especially is time sensitive, like if they need a cancer screening or something like a stroke response or something that is time sensitive, they are going to have delayed care because they had a bad experience. And so it negatively affects their health outcomes and how likely they are to recover from something that would otherwise be treated appropriately if it was treated in a timely fashion. And so all of these negative experiences impact multiple things down the road. And that is something that physicians and healthcare providers, nurse practitioners, PAs, everyone needs to be aware of. And it's negative experiences with the entire healthcare system, from the person that meets them at the door to the person that collects their blood, to all of those things. And so we have to be really intentional about how we craft the patient experience, because we are telling them if we can be trusted in the future as a healthcare system.
I couldn't agree more. And I know I keep saying this, but I really do believe that you are teaching us how to care for ourselves throughout our lifespan, and how this critical encounter that we're having now is going to inform how we show up for the rest of our lives. So
Yes.
thank you so much, Dr. Chambers, for this. This has been not just revolutionary for Alicia and Maya, but for myself and for so many of us that will watch this. So let's take a break. We're going to pause and close case one, and then we'll come back and talk about postpartum care. We'll be right back.
Get trusted resources backed by medical pros for your health. Tap into real experiences from people who look like you, and find a safe place for your story. Walk into a space where being you is celebrated, and find your power. Your health, your story, your power.
Welcome back to Beyond the Chart with the fabulous Dr. Charis Chambers. If you missed the first half of this, please go back and hear from Maya and Alicia. It was an amazing case, and I know it will help you and your family as well. Now we're going to talk to Sasha. Sasha is a 31-year-old female. She lives in a suburban healthcare desert. While the neighborhood looks stable, the nearest level 3 trauma center or specialized cardiac unit is a 40-minute drive away. Public transit is non-existent. She is a mother of a newborn and an energetic 4-year-old. Her husband is supportive but works long hours and has been socialized to believe that postpartum is just a tired phase. I know no mama want to hear that at all. So her chief complaint is that she feels like she can't catch her breath even when she's just sitting down. And she feels like her heart is racing for no reason. There is suspected postpartum cardiomyopathy, and her presentation includes dyspnea, which is shortness of breath, and pitting edema or swelling in the ankles. Sasha is stuck in the care gap. She doesn't have a car during the day, and a 40-minute Uber to the ER is a significant financial hit. She is prioritizing her newborn's pediatric well child visits over her own escalating symptoms. Financially, she has a high deductible insurance plan. She is terrified of a $3,000 ER bill for what she hopes is just anxiety or exhaustion. So she is waiting for her 6-week follow-up. So Dr. Chambers, what exactly is postpartum cardiomyopathy, and why does the heart sometimes begin to struggle after the baby is already born and the hard part of labor is over?
So postpartum cardiomyopathy, or what we often call it, is peripartum cardiomyopathy. And the reason we say that is because It is a special type of heart failure and like heart degeneration that occurs within 1 month of delivery or like preceding delivery or 5 months after delivery. It is characterized by there being a significant decrease in how well the heart pumps blood. And so when you think about your heart's whole job is to receive blood, pump that blood to the lungs so that it can get oxygenated again, and then pump that blood out to the rest of your body. That portion that pumps it out to the rest of your body, when it is not at its max potential, it can decrease, and that starts to be categorized as heart failure. Typically, we see that it's going to be called heart failure when it's less than 45%. So not 80%, not 70%, when it's less than 45%, that's when we say you are in heart failure, right? And so that's a major issue because as we highlighted in our case, that can lead to feelings of like shortness of breath. Like, man, I just don't feel like I can catch my breath. It can lead to edema or additional collection of fluid in the lower extremities or in the body because your heart just isn't working very well. It can make you feel super tired. But this is a major issue with high risk for mortality, for high risk for actual death. It's one of the leading causes of postpartum deaths, and it's something that cannot be ignored. In this case, they highlighted that she's prioritizing the well child visits for the new baby and putting off her care, but what your baby needs is a well mother. Your baby needs a living mother. And so when you are toying with these types of symptoms, it is not the time to prioritize finances or put yourself last. You must get urgent evaluation because it just might save your life.
I think you're pointing out something that's so important is that typically as a mom, like you mentioned, being a mother, I know you want your child to be well, but like you're mentioning, you have to be well. Like
Have to be well.
these children need a mother that is also well, and you're really pushing her to rewrite the rules of what we believe about motherhood and say for yourself, no, you want to make sure that you're well so that you can show up fully and exist in these children's lives.
And a lot of people, as you mentioned, think that postpartum is just, you're just tired. You've already gotten through the hard part. Postpartum is one of the most precarious and vulnerable states that a woman can be in. The risk of clotting is significantly higher. The risk of heart failure, those things are very significant. The risk of hypertensive disorders, all of those things remain elevated and sometimes go even higher in the postpartum period. So it is a total misconception that once you deliver that baby, that you are out of the woods. And 6 weeks is too long. That 6 week visit is the standard just because that's what we've always done. But that isn't the standard for capturing symptomatic issues like shortness of breath and edema and increased fatigue. When you've got those things, that cannot wait. 6 weeks is too long.
How would a mom or how would even a caregiver, someone close to them, their partner or friend, how would they know the difference between normal newborn exhaustion and a life-threatening heart issue?
Normal newborn exhaustion is like, I need to sleep. I need rest. Not, I cannot go up the stairs without having to stop to catch my breath. Not, my legs are profoundly swollen in a way that is atypical for me. Not, I'm tired and I just woke up and I barely moved a few steps. Those things are out of the realm of normal. Yes, there's an expectation of being tired because you're not sleeping well. But this is the type of tired that doesn't improve with sleep. This is the type of tired that shows itself after you've walked 12 paces or up, half your staircase. And the shortness of breath and the heart racing aspect for me is the real kicker. Those are the things that cannot be ignored. You cannot talk them away. You cannot slow breathe them away. You cannot meditate them away. Those are the things that get my attention that say, hey, you need to be evaluated now.
I always think like the way that you broke it down gives them plain language. Like, you know how online when people see like these red flag symptoms, they read it and they're like, oh, I don't have these things. But the way that you're breaking it down is clear. This is what you will experience in your body to tell you that it is an emergency.
No, you have to. And even just feeling off. And I know that feels weird. It feels nonspecific. That matters. That happened with my sister. And my other sister was there. And she said, check your blood pressure. And my sister, the older one, not in medicine, not even at all. She's in law. She was the one who
Wow.
said something is wrong. She's like, I just don't feel quite right. I feel like I need to rest. My sister was saying all these things, but she had every risk factor. She had multiple gestation. She is African American ancestry. All of those things that increase your risk for complications. And she ended up having postpartum preeclampsia that was recognized because my sister said, this is not right. Check your blood pressure. And then immediately sent her to the ER. So like, the
Wow.
people around you have to be aware. It's not enough for you
Yes.
to be aware. We carry all of that, but you can't carry that. You have to have a team, and that team has to be educated so they can support you.
And we have to be our own community and care system. And that's what you're saying in your book to the mothers and their children is like, we are our own community. We are the ones who are advocating for ourselves. And when we don't know how to advocate or we're learning to advocate, we're modeling it for the next generation until the healthcare system can catch up. And that's something that is missing. And I really want to know, how can we, I know we can't shift the entire healthcare system, but what can we do so that the fourth trimester is prioritized better as a critical, like, cardiac window?
So I think a really important thing that you highlighted is just letting everyone know. Most of us know who our village is. Like we know who's going to be with us postpartum. We know who we can count on, who we can call on. And so letting them know. I educated my husband. I knew I was high risk. I literally had all the things. I was advanced maternal age, African American ancestry, a history of hypertension, all of the things that would put me at high risk for peripartum cardiomyopathy or preeclampsia. I let my husband know these are the things you need to look out for. If I have a terrible headache, if I lose consciousness, if I start to have convulsions, if I complain of right upper quadrant pain, any of those things, if I seem like I'm short of breath, no matter what I tell you, make sure I get care. And so pulling people in so that they feel like they have action items for how they can show up for you and letting them know what that looks like. Taking them with you to your visits. I brought my husband with me to my visit, and they were like, hey, I don't need to explain all this to you. You know it. I said, but he doesn't. Talk to him. I said, let him know. And
Yeah.
it increased his awareness of what was at stake. That yes, I've done everything to try to be healthy, but at baseline, because of my chronic conditions, my risks are higher. These are the things we're worried about. This is how you can show up. And so just by saying, this is what I'm worried about and this is how I need you to show up, yes, that's really vulnerable. Yes, that can feel scary, but it gives them an opportunity to intervene and the education and the wherewithal to do the right intervention in like when you need it. And that makes all the difference. It literally can be a life or death type of situation.
It absolutely can, especially for Black women. We see it all too often. It absolutely is the difference between life and death for us. And for a mom in a healthcare desert like Sasha, I know a lot of us can relate to Sasha and living in these healthcare deserts. And let's just say it is someone who's worried about cost and the drive. What are the steps that they can take to get screened without waiting for a crisis?
So you can call your doctor, your delivering doctor, just because your next appointment is at 6 weeks. And I literally say this with all of my patients, pregnant or not. I am scheduling a follow-up for you in 6 months with an expectation that you are doing well. If anything changes, if any concerns arise, if you need me sooner, you do not wait for that visit. That visit is not a predictive visit of how you are doing. You know how you're doing. You need to call and let me know if that visit no longer suits you. And that's the same thing postpartum. You need to reach out to your doctor and say, I don't feel well. Something new has arisen. I have fallen off the trajectory of normal recovery and I need urgent evaluation. So calling your doctor to let them know might allow you to get into your doctor's office so you're not going directly to the ER, and then they can triage you there, do the baseline, evaluations of blood pressure, pulse ox, those sorts of things, and let you know if it is worthwhile for you to go to the ER or if it is more of that normal exhaustion and you just need reassurance. But do not wait. Don't just reassure yourself and don't minimize your symptoms because you worry about bothering someone or it costing too much. Nothing, nothing, nothing is worth your life. Like a $3,000 deductible, whatever, a $500, $80 Uber, your life is worth more than that. And so I beg of you, if it's going to be an $80 Uber, take it. If you need to, reschedule some things, take it. If your husband needs to miss work, even though he's the breadwinner, to take you to the ER or to sit with your children so you can go or whatever, take it. Your life is worth more.
I could not think of a better way to close out this episode than urging all of us to believe what Dr. Chambers is saying, that our life is our own and it's worth more.
Yes.
The way that you spoke today spoke to me, and I know it's going to speak to so many of us who have never heard that we're safe, that we have autonomy, and that we are like the boss of
Yes.
this. Like
Yes.
we are in charge of this, and it's okay to say, I feel scared. I don't feel safe. I need support. You have truly given us language to advocate for ourselves so that we can live to be 100 if we want. So I am truly so honored that I got to be in conversation with you, that I get to be in this generation with you, that I get to be a Columbus girl that grew up very close. But no, this was just truly so amazing. Thank you so much, Dr. Chambers. And thank you so much to the Now Included community. If you relate to these stories and you want to be a part of the story, you want to share what you're going through, please join Now Included and share your story with us today.